Hi, I'm Thomas Gillespie. I'm a professor at Emory University and the Rollins School of Public Health in Atlanta, Georgia. My position is between the departments of environmental science and environmental health. And for the past 20 years, I've worked on issues of land use change and disease dynamics. I started working in Madagascar about 5 years ago. Prior to that time, I'd been working primarily in sub-Saharan Africa, but also in the tropical parts of Latin America. Madagascar is very special for a number of reasons. It's the oldest island in the world. It started out as a landlocked plateau in Gondwana land, and it was sandwiched between the land masses that now make up Africa, Antarctica, and India. And as all of that split millions and millions of years ago, Madagascar was left very isolated. And so a unique assemblage of species has formed in those many years of isolation. This is actually the last large landmass settled by people. People have only lived there for the past 2,500 years. So why have we seen such a high level of land conversion in such a short period of time? Paddy rice cultivation developed in association with slash and burn agriculture. But it's really this culture of fire that has led to Madagascar being so heavily deforested. So when we think about the question of land use change and disease, we're typically thinking about two different aspects. We're thinking about how are pathogens coming out of natural systems that can affect people, and we're also thinking about how can we and our domesticated animals send pathogens into a system affecting endangered or threatened species. In Madagascar, because most of the forest is gone, we're left with about 10%, actually quite a bit less than 10% of the original forest cover for the island. We're left with these remnants, and people are living in proximity to the remnants. And it's the poorest people who live in proximity to those forest remnants. There are a few things that happen in disturbed habitats that affect disease in the wildlife. In the first case, you can actually alter the ecology of the natural pathogens of these organisms. In some cases, that will be related to immune function and how well the species may act as an amplifier for a pathogen. In other cases, it could affect how easily they're going to become infected. And so all of those things lead to a complex dynamic that could lead to something that's more virulent, jumping to people when the opportunity arises. So in terms of pathogens that jump from wildlife to people, we have two scenarios that concern us. One is the emergence of novel infectious diseases. That's something that you guys hear a lot about. You hear about Ebola. You may have heard of Nipah virus or Hanta. These are things where you see an outbreak occurring, and then you won't hear much about this for a long time, and then you might hear about another outbreak, but you're not seeing sustained infection in humans. In addition to that, we can have cases where there's chronic transmission, where you may have an interface where there are always pathogens passing from wildlife to people. And you hear a lot less about those, but in many cases they can be more important to the rural poor, because those are the things that cause diarrheal disease. Those are the things that can kill children, and they're often the most vulnerable. The second way in which we see the interaction is that you could have a pathogen from humans or domesticated animals jump into a wildlife population and then evolve in relation to that new host in a way that could then spill back to people in a way that could be very detrimental. That's something that we're concerned about in relation to antibiotic resistance in a number of bacterial pathogens. We know from many systems that we worked in that resistant bacteria are being transmitted to wildlife from people, and in some cases also from our domesticated animals. What happens when that pathogen is then in this new host? And then presumably can have the opportunity to spill back at some point depending on contact rates or human behavior or animal behavior. So although we don't see evidence of pathogens jumping from lemurs to people, we have quite good evidence of the inverse, that the lemurs are getting infected with pathogens from people. In the system that we've been studying, we've been able to look at lemur populations of many different species in the interior of a national park, Ranamafan. They're exposed to the local human population as well as a large number of tourists. So more than 20,000 tourists visit this site per year. And the lemurs that have the high human exposure have a high prevalence for a diversity of pathogens, especially pathogens associated with diarrheal disease. For a subset of those pathogens, we've been able to screen the animals that live in the core, the interior of the biosphere reserve. And we don't find any evidence of exposure to these pathogens in those animals. So this is a first step in understanding that dynamic, but it suggests strongly that we're seeing human exposure to the lemurs for these pathogens. We've done work in a number of other systems, especially with great apes, where we've been able to show this with a smoking gun, where we actually can look at the complete sequences, compare them, and also look at the patterns of resistance in bacterial pathogens. And we see very clearly that it's human to wildlife transmission. So a similar scenario in Madagascar. The bottom line is, wherever you have high biodiversity, you also have a high diversity of pathogens. The pathogens are going after all of those niches in the same way that species, are going after their niche within the system. And so we always see a higher diversity of pathogens in high diverse systems. The issue is that when we disturb those systems, we allow for novel interactions that can alter transmission dynamics, provide for novel opportunities for species to jump. It's during that process of transition that the risk is the highest. And so some may say, well, all of these pathogens are in these forest systems, we should get rid of the forest. That's actually the very worst thing you could do, because during that process of trying to get rid of those sources of pathogens, you're creating the highest risk of transmission, risks that wouldn't occur if you left the forest alone. So because the situation in Madagascar is so dire, Patricia Wright began efforts to not only study lemurs in Madagascar, but also to deal with the major conservation threats. And she began this work more than 25 years ago. She asked me to join her efforts 5 years ago. And so I'm a member of the board of the Centre Valbio, which is a major research station in Madagascar. And from that research center, we have a number of mandates, including ecological research, but also, very importantly, providing opportunities for local communities that relate to outreach in terms of health and hygiene, outreach in terms of education, and outreach in terms of providing opportunities for employment. And one of the components of that is actually to help people to develop sustainable agricultural techniques in the area. In addition to the Centre Valbio, we've established Pivot. And Pivot is a health intervention that's been incubated by Partners in Health. And through Pivot, we provide healthcare for more than 56,000 people that live in proximity to the Ranamafan National Park. There haven't been a lot of opportunities to actually study whether or not providing healthcare truly will cause people to use natural resources in a more sustainable way. And so we're actually studying this process as well. I have a lot of hope for Madagascar, and a lot of that comes from what I've seen of the Malagasy people in my time there. There's a very capable generation now that is coming out of university, and they're aware of these issues. Many of them have been trained internationally, and they're passionate about solving these problems, whether it is sustainable agriculture, forest conservation, and seeing how well they navigate the international community related to these issues, as well as how much they're able to get through to the people of their own country. I'm extremely hopeful. I feel like a lot can change very quickly.